For all those curious about the human body's magical stunts, here is a surprising comparison between injuries and their healing time. You'd be surprised to find out how long fractures take to recover. So, wear your protective gear as we dive headfirst into the ultimate showdown of speedy recoveries. Number 1. Starting off with the tiny warriors of the injury world, cuts and scrapes. These little guys might sting like a bee, but they're the sprinters of healing, often zipping up in just a week or two. They might leave a cool scar story behind, though. On the flip side are the mysterious bruises. They're like the ninja healers. You wake up with one, and poof, they're gone in about 2 weeks. They vanish quicker than a magician's trick, leaving you wondering, where did it go? Number 2. Now, let's talk about sprains and strains. They're the marathon runners of injuries, taking about 2 to 6 weeks to get back on track. Stay patient, folks. It's a slow but steady recovery. And here come the heavyweight champions of the injury world, fractures and broken bones. Brace yourselves, people, as these big guns might take 6 weeks to several months to heal. Time to Netflix and heal. Number 3. And in the injury Olympics, torn ligaments grab the spotlight. These champs can take anywhere from 6 weeks to a year for a full comeback. It's a roller coaster ride of patience and rehab. Grade 1 strains may heal within 2 to 3 weeks, while Grade 2 or 3 strains might require 4 to 8 weeks or more for complete recovery. In comparison, ACL injuries with surgical reconstruction followed by extensive rehabilitation can take 6 to 9 months or longer for a return to pre-injury levels of activity, while non-surgical treatment might extend the recovery to a year or more. Number 4. Simple ankle fractures might take around 6 to 8 weeks to heal, but more complex fractures involving multiple bones or severe displacement may extend the recovery time to several months. Minor tears, on the other hand, might heal within 4 to 6 weeks with conservative treatment, while larger tears might require surgical intervention and longer recovery, up to 3 to 6 months. Number 5. Healing time can vary, but it often requires 6 to 8 weeks of reduced activity and proper rest to heal completely. Healing time varies widely depending on the type and severity of the fracture. Stable fractures might take around 2 to 3 months, while more complex fractures might require 6 months to a year or more. Number 6. If shoulder feels better within a few weeks, don't mistake it for complete recovery, because full healing and regaining strength might take 12 to 16 weeks or longer, especially with recurrent dislocations or associated injuries. Partial tears might heal with conservative treatment in 4 to 6 weeks, whereas complete tears might necessitate surgery and 3 to 6 months or more for full recovery. Number 7. When it comes to Achilles tendon ruptures or sprained ankle ligaments, getting better can take some time. For minor sprains, you might be looking at around 1 to 3 weeks to heal. However, if it's more serious, it could take 6 to 8 weeks or even longer. Some cases might need help from physical therapy. Treatment can vary. It might take 4 to 6 months up to a year or more, depending on whether you go for non-surgical or surgical options. Number 8. When it comes to compound fractures or a ruptured patellar tendon, they usually need surgery to fix the bones or tendons and a long time to heal. It could take several months up to a year because there's a risk of infection, and these injuries are complicated. After surgery, it might take about 6 to 9 months of rehab to get back to normal activities and sports, but sometimes it can take even longer to fully recover. Thank you for watching. Hit the like button and let us know you enjoyed the video. And don't forget to subscribe to our channel for more informative videos.